I came to Stanford in 1997, so I can't remember exactly when it was. But the original developers of the robot were at Stanford Research Park. And it was being developed for a military application or space application, both. And I got asked, hey, you want to come and check this out? You can help us out. We need some test subjects. And it was a porcine model where there was a femoral artery laceration in a room down the hall. And I was in a different room and I had to repair this artery robotically. And that was that was the first time I'd ever heard of robotic surgery and what people were thinking about for robotic surgery. So fast forward a couple years, and I think the first commercial robotic procedure was in 2001. I think that's when it was. And it really came out, in urology. We had people doing laparoscopic prostatectomies. And at one point in time, we got a robot, Stanford got a robot, and one of my colleagues, Miriam Curette, who now is the senior vice president and I think she's still the chief medical officer for intuitive surgery, sort of got very interested in the robot. And we were close colleagues and we were talking about it and I'm like, wow, you're right. That really sounds very interesting. I was also watching the development of the natural orifice surgery. And the big one was, gallbladders out through the stomach or through the vagina. So there were these two technologies coming out, all sorts of buzz about these technologies. And I had watched firsthand as a resident, watching people not adopt laparoscopy and then get totally left behind. And I was like, okay, technology is going to change. You're going to have to change with it. I was probably mid-career at that point in time, and early to mid. And I assessed the two technologies and thought robotics is going to be the killer app, not the notes. I think that assessment was good. It took another, God knows how long before we finally have our first real endoscopic treatment that's, I think, a solid winner. And I started, so for general surgery, I think I did my first robotic case in 2006, 2007. Very early adopter. It was really focused on prostate. I think it was I was doing all my operations either open or laparoscopic. That sort of progressed for a while. And I had converted a lot of my operations from open to robotic. But when the XI came out, that was a game changer robot because the older versions were great for like small dark hole places, like a prostate, or one area that you're operating in. With XI, since I do complex GI cancer surgery, I work in multiple quadrants. When the XI came out, it really opened up surgery in a different way. So now I only do two types of operations. I either all do open, and that's dependent on a patient or cancer characteristic, or I do robotic. I've actually stopped doing laparoscopic operations, except for appendectomy. I'll still do a laparoscopic appendectomy. It's been really interesting to see what people do when they innovate. So last year, they were all procedural videos, and I got to see ENT procedures. One of them still sticks in my brain right now. I mean, it was such an amazing, I was like, wow, I can't even believe somebody would think about doing that. The video was amazing. I learned a lot of anatomy watching the video. It's not an operation I do, and I could see it so well, and the video was so well made to illustrate all that. And it was just really interesting to see how people are just innovating and always taking it to the next level. And then this year's, it was great to see more non-urology videos. I'm not a urologist, so it's kind of fun to see other videos too. And to see now videos also talking about simulation and training and sort of a different aspect because you can innovate in all those different regions. So I liked the wider breadth of the videos this year. And once again, I thought the quality was excellent. And I think people also don't understand, a lot of people don't understand that you can actually learn by watching a video. I myself belong to these Facebook groups where people post their robotic videos and ask for comments, and to see, and I've adopted innovations that I've seen others do there. Like there's this DEMA stitch you do for sewing up the, using suture to suspend the lateral segment so you don't have to put another port in. So from the patient standpoint, that's a great innovation. One less entry point, one less point for pain. And so I think video is a really interesting way to get education and let people see what's going on, and for trained surgeons to watch and be like, wow, that's interesting, I'm going to try it. Innovation was defined by this IDEAL consortium in 2009. It's this newer modified, and there's this 3-level taxonomy we think about. You can change an instrument, you can revolutionize some equipment, or you can revolutionize science. So a lot of us think about equipment. I'd like to just highlight some innovations that have changed the world in some ways. When I knew that I was coming here, I had been at a conference last April, and for that conference they have guests who come. They have 2 guests that they sponsor to come from the European Surgery Association. And I met one of the surgeons there. He's also a robotic surgeon. We kind of hit it off. We talked. We then met, I was then the guest at a European society, and we met again and we talked, and we're trying to plan some joint research projects. And when I knew that this was going to be here, I looked at a map, and he's an hour and a half away in France. So I came early in the week and then spent the last 3 days at his institution. They have 3 different kinds of robots, so that was really interesting, because in the US we only have 1. So I've seen it at shows, but I haven't actually been able to see it and talk to people who've used it. And just the idea, the exchanges, the interactions, that's why going to conferences is so rich. You get to meet colleagues. One of the gentlemen here I'm going to meet with after the next break wants to talk to me about the subject that I spoke about today. So I'm sure there's going to be some really interesting interactions there. I think that it's very interesting to see, like at lunch, I was listening to the impact the foundation has had in India. How one man's vision has really changed the kind of the whole surgical climate in India by the foundation's interventions there. I mean, it really, truly like skyrocketed robotic surgery and minimally invasive surgery to India, and therefore, millions and millions of people. So, and I think the sponsoring of this award and seeing it get bigger and bigger, and I think getting out of just India now and going worldwide, I think shows a lot of vision. And I thought that his comments this morning really were very interesting about, always making sure it is about the patient. It is always got to be about the patient. And how can we continue to drive technology and innovation to make our patients' lives better?